Thank you for joining us for Politically Speaking. My name is Shawn Williams, and I'm the director of the Kentucky Heartland Institute of Public Policy here at Campbellsville University. This is our podcast on political science, politics, global affairs, and global events. One of the things that I talk about a lot in my classes is the purpose of government, and this is something we discuss. Governments, especially in liberal economic systems, they're not really that concerned about you. The assumption is that you're capable of being responsible for yourself, of making sure that you have a job, that you can provide food and housing for your family, that you can provide your own health care. What governments are really about is creating and maintaining, protecting the systems that are necessary for you to get access to the goods and services that you need. This is something that we're seeing a lot of with the coronavirus scare that we're currently going through. While the number of deaths are certainly a concern, what the government is really worried about, what it needs to be worried about, is ensuring that the healthcare system doesn't collapse under the weight of the pandemic. This is what most of the steps are about. They're about protecting the hospitals and the ICU units, not necessarily about protecting individuals. The problem is that what we're also starting to realize is that the healthcare system, it's not the only system we need to be worried about. In fact, the broader economic system has as much to do with providing for the general health care and welfare as does hospitals or doctors. If we see a collapse in the broad economy, then we will have citizens who have food insecurity. We may have gaps in other forms of healthcare coverage. And what we typically know is that when the economy starts to collapse, you see things like increases in crime, drug use, and mental health problems. So in short, we need to be aware of the fact that while the efforts we're seeing to slow the spread of the coronavirus are absolutely necessary, we don't want to cause a greater health or welfare crisis by creating more economic damage than the healthcare system damage that we prevent. Now, there are a couple of ways that we can do that, and we're already starting to see some governments do some of these. The first is to focus on increasing capacity, and not just in the short term, but preparing for long-term capacity so that things like this don't happen again. We're seeing states, for example, trying to increase the size of their ICUs or improve capacity. Recently, Donald Trump has invoked the Defense Production Act of 1950 in argument that we can use that to better build face masks or respirators, ventilators that are used in healthcare clinics. Something else we need to be considering, though, is random testing for the COVID-19 virus. Now, the reality is that we're currently tracking the number of identifiable cases, and we're really worrying about the number of deaths. But what could very easily happen is that with so many cases being mild, we could see a decrease in the spread of the contagion well before we start to see a decrease in the contagion's effects. If that happens, we as a society need to start thinking about policy changes. There could very well be a point where the spread of the disease slows, and we need to start thinking about how to protect our economy and return to normal, even if that means running the risk of increasing the number of cases of coronavirus. Now, none of this is to say that I do not support the efforts that we're taking. They're very necessary. Isolation and social distancing are really the best protections we have against the spread of the coronavirus. What I am saying is that good policy planning always requires you to think about the big picture. And it also requires you to think about the future as well as just the present. Now, if you like this video, check us out on YouTube, Instagram, and Facebook, and see the others that we've been providing here through Campbellsville University. Until next time, thank you and God bless.